I mean, I know you do minimally invasive surgery in your office. I do the surgeries that I do are mostly like I do some like bunions and hammer toes and things like that at the surgery center. But yeah, I have been. The only thing I encourage post-op is the MLS laser, because it does help the incision heal a lot better, and a lot of patients have a lot less pain after the surgery, and they heal a lot faster.
If you started to add, yeah, I do a lot of Wharton's jelly post surgery for my patients. So after I put my last stitch, instead of hitting them with the common cocktail we all used in residency, or other practices, little lidocaine or with some Dex at the end, I just do Wharton's jelly at the end, and I have found that. I mean, the patients that sign up for that versus don't, it's a night and day difference, because, even with minimally invasive surgery, you're still dealing with pain and swelling. That never goes away regardless, but it really does decrease the edema I see with patients. Also, just overall pain-wise, pain is substantially decreased. I'm seeing unionization on x-rays faster with these patients too. And then, of course, I use MLS all the time for post-surgical patients. So again, it really creates the two really create a great environment for patients to heal fast. I think MLS alone is phenomenal. I love MLS laser. It's a great modality.
I love it. My patients are so happy. It's like, especially the neuropathy patients, it's like a gift, because there's like this new technology. The technology has been around for a while. Like I remember, laser from when I was in college, when I was in podiatry school, they had them show us how to use that laser and what it does.
Yeah. I wish they would show it more. Back then we were all skeptics, but we're now in the field practicing.
Talking badly about low-level laser therapy, and then the MLS is different, because it's like it's a double beam, it's a double laser beam, so it's a healing laser as opposed to the other lasers out there.
Yeah, it's definitely the premier laser. And here's another thing, I tell patients, because sometimes they're skeptical, and I go, this company, Cutting Edge, and we're not sponsored by Cutting Edge, by the way, just FYI. If your patients are seeing this, I want them to know we're not getting paid to say this. I'm just saying this because I truly believe in the laser. But if Cutting Edge wants to pay us, I'm sure we're here for that too. Anyways, the company was actually designed for veterinarians. I don't know if you know that, but for 6 years.
I heard about that. Yeah, I heard about that.
You cannot fool an animal. There's no such thing as placebo in animals. If your dog had just had ACL surgery or something, a fracture, etc., they had RIF, reduction control fixation, or they just are having bad arthritis, because animals do. This laser really helped a lot of these animals. Now, finally, 6 years later, they bring it to human medicine. You can't trick an animal, and my patients who go through it also just swear by it too.
Now, when do you not use the Wharton's jelly injection?
Honestly, I try to use it for everything. I don't use cortisone in my office. If I have a patient that is asking me for cortisone, I actually will just refer them out, because I don't believe in cortisone. I truly don't. No, I don't. I don't believe in it. I can count on one hand how many times I've used it since I started my practice here. But ortho group, I used it all the time. But I saw a lot of bad reactions with it, so I refer people out.
So I still use it, mostly because I don't have the hybrid concierge model that you have yet. I see a lot of insurances, and people want what is covered by insurance, and that's what's covered. I tell them, Wharton's jelly fixes your issue. The only thing that's covered by insurance is talking to me, a prescription for medication, physical therapy, and a steroid injection.
Well, it may be. We don't even know nowadays with insurance. They're cutting everything now. Sometimes even physical therapy is not covered by insurance anymore. It's actually kind of ridiculous what's happening.
They limit it like per year. So it's sad, but I tell patients, it's kind of sad that like medicine is advanced, and there's actually evidence-based medicine to support all the things that we are doing, especially the Wharton's jelly injections. I've seen a lot of studies on it, but these Medicare guidelines are not keeping up. They're like stuff.
Oh, they're so backwards. Don't ever expect regenerative medicine to ever be covered by insurance. It's never going to be. It's you and I can have a whole different talk with you about insurance, but I hate health insurance. I have health insurance, but health insurance in our country nowadays, truly by 2030, the average deductible will be $10,000. That's what we found out. So your health insurance is truly for catastrophic reasons at this point. God forbid you're a life-threatening accident. You need to go to the hospital. You have a life-threatening illness. You have a baby. Those are reasons to have it. But to come see you and myself, your health insurance really is not going to be applicable. You're going to be paying a high deductible. A deductible to see us anyways. So why not use that money and use it towards something that's actually going to help your health versus something that's going to put a Band-Aid on it, versus something that's going to keep you coming through my door over and over again. You're going to get frustrated with me. Doc, you keep giving me the same injection over and over again. Why am I not healing? Mrs. Jones, remember what I told you. Steroid is only a Band-Aid. It's not something that's truly going to help you.
I actually there's an example I use on myself. It's like a sad example. I don't like to talk about my personal life too much, but like I need a fertility doctor to help make babies, right? Sure. And according to Blue Cross Blue Shield, like I have insurance, and according to the insurance guidelines of my insurance company, it's not medically necessary to have children, so they refuse for any fertility treatments. And like that's where society's going,
Yeah.
and it's like you're in a
Yeah.
birth rate decline, and I hate talking about it's like sad, but like, and you know what? I took out my credit card and I'm paying
And you
it
paid
off,
and you paid for it.
and I paid for it, and then sometimes it was successful, and I have, thank God, I have a beautiful 3-year-old daughter,
Yeah.
and then I had lots of failures before her, and I had a couple after her, but you know, it is what it is, and I paid for it because it's something I want. So like, I tell my patients, if you want, you know, you don't expect your insurance to pay for everything. You know, patient. There's like this mentality that they want insurance to pay for absolutely everything, and it's
Yeah.
not reality. Like,
It's not
it's
reality.
good for,
So
like you said, event.
first of all, thank you for being vulnerable and sharing the story. That's that's not easy to share. But to your point, right? You paid out of pocket for something that you truly believed in, and you have a daughter, right? 3-year-old daughter. That's amazing. That's
Yeah.
a blessing. So you know, if you truly believe in something, you're going to do whatever it takes to get it. That's my that's how my personality is. So you know, I think that's the way the message is to our patients too. It's that, look, there's a lot of great modalities that are healthier for you, right? That's the other thing, is we don't talk about side effects. These insurance companies will cover the blood pressure medication, the statin, the whatever, okay, but there's no talk about the side effects, the illnesses that come and follow this medication. Just because it's covered by insurance, let me take it, right? But let me now educate you on all the bad things that can come with it, and you let me know if you still want this medication.
Yeah, I tell patients with neuropathy, like I tell my patients, all those like gabapentins and Lyricas that they use, I say, it doesn't fix your neuropathy. We have to do things to wake up your nerves, right? Because that's the whole point of regenerating the nerves, regenerative medicine. So for neuropathy, I do a combination of vitamins, CBD cream, and the laser. Patients feel better by like the third or fourth session.
Yeah, no, that's
I
phenomenal.
don't give them any medications, and I encourage patients to exercise more. It really helps stimulate the nerve to wake up. But all those other pills, they just put Band-Aids on it, and they have really
I
bad
know.
side effects. Even today, why did they put me on an antidepressant for my neuropathy?
Yeah, they do that. No, they do that. They do that. That's actually a very common practice nowadays. You know, again, these docs, and again, I respect all our colleagues, okay, but
Yeah, so do I. But we're
I
people
think
like you and me. We're in this for, I guess, we're out of box thinkers, and that's why I started the whole regenerative medicine game, because I like to fix the root of the issue.
a root cause.
The root cause. Even with fasciitis, you know, if patients, if their calves are extremely tight, I actually use my shockwave machine to loosen up their calves and break up all the adhesions in the
You told me
abdomen.
that. That's pretty
It
cool.
works pretty well. And you know, physical therapists use it, and why not use it in a combination? And chiropractors use it too. Why shouldn't, like, that's why I started using it as part of my protocol, because if they're tight and they did physical therapy, or they're too lazy to stretch at home, 1 or 2 sessions of the shockwave just on the leg, the back of the leg, loosens everything up, and it takes so much pressure off the fascia. So that's why, like, every patient, case by case, like I have to see like what's causing the tendonitis, what's causing the fasciitis.
So if a patient that comes in with plantar fasciitis, are you doing the calf or the aponeurosis first, and then and then the heel at the same time?
Yes, I am doing it at the same time. Like, if it's like, I was just thinking, so I had someone on Friday, we just did the legs because she just had the tendonitis, the Achilles tendonitis. But for fasciitis, I do both the calf and the fascia.
Okay.
When I do the shockwave, the patient, most people sign up for shockwave because there's no downtime versus getting the Wharton's jelly injection.
Yeah.
So that's like, they actually feel better right away. The shockwave, it breaks up all that, the adhesions, brings new inflammation to the area. I also tell patients not to take anti-inflammatories. I tell them, you know, you want the inflammation. It's good for you. It'll help heal. But and every time I tell patients that with the Wharton's jelly injection, they need the boot, they kind of, they deviate from that.
I know what you mean. There's something, I don't know what it is. There's something about wearing a cam walker for 2 weeks. It's just like, you know, it's almost like they're like rubber.
You know?
I don't understand that.
Especially the driving foot, it kills them. You know, people don't want to be limited. I get
it's inconvenient. It's inconvenient, but then you got to paint that picture, right? It's like, look, it's 2 weeks of your life versus 2 weeks of your life is a drop in the bucket compared to how long we live as human beings. So 2 weeks to truly try and get you out of pain, I think, is something you can do for yourself.
I actually have a patient. Have you ever seen these like peg leg walkers?
Yeah, I've seen them.
It's like you put your knee in, and like you have a peg leg, and then your foot's hanging up in the air.
I've seen that.
She's like, I get a lot of looks at the store, but it works. She finally like kept off her foot, and her fasciitis went away. She's so happy.
That's great.
Yeah. Any other nuances before we sign off?
I was actually going to ask you, what's your neuropathy protocol for MLS?
Okay, so I do 12 sessions of MLS to start with. For first 3 sessions in the first week to create the buildup effect in the cells, because you have to wake them up. And then I do the EBN6 vitamin from the EBM company. It's a great vitamin. It helps glycosylation and renewal of the nerves. And then I encourage patients. I also set up the physical therapy, especially the older population, physical therapy to just do like gait training and balancing, just to try to get them more mobile. Yep. And then the other thing is I really like the CBD cream. And if the patient doesn't want to pay for it, then they go get some over-the-counter capsaicin cream. That works as well.
I see. No, that's very similar to what we do too.
There's also a machine that sometimes I prescribe if the patients have insurance. It's called the Zynex machine. And it has it's like a 10 unit, but it has an interferential current on it, and it stimulates the nerves to wake up and heal. And it helps a lot with the symptoms of neuropathy as well.
Oh, that's interesting. So you do three sessions of MLS the first week, and then you do 1 session per week after that?
No, 2.
2 per week? Okay.
I do 2. Yeah. So I tell patients the more they do it closer together, the faster the nerves wake up. I actually had one neuropathy patient that did 5 in a row and felt like $1 million.
Awesome. And are you doing their protocol where you let the robot go over the dorsum of the foot and then you use the trigger point laser to hit the legs? Is that your protocol?
No, I actually I do each leg. I do the right leg from the common fibular nerve all the way to the dorsum of the foot. And then so I do 9 minutes on each leg like that. And then I put the bottom of their feet together, and then I do another 9 minutes with the bottom of the feet together.
Okay. So and you're letting the robot?
Yeah, it's a robot. Like it's a free. I didn't hear you. What?
I think you answered. You said M7. You got the M7, the robotic.
Yeah, I have the robotic one. So it has the handheld piece, and it also has. So we just do the setting. We do the whole entire leg, both legs. It runs for 9 minutes. We scan it, and we run each leg for 9 minutes, and then the bottom of the feet together, another 9 minutes. The patients are here for about half an hour, but it really does work, and I always crank it up. I always double power it because I want to do right by my patients and get them the most relief. And my patients, I also do that for chronic arthritis. I have someone, I actually treat knees down here sometimes. I have like a mailman with bone-on-bone knees, and he really doesn't have time to have a knee replacement. And he just comes in, gets a couple, he did the initial like 6 in a row, and then he comes in about once a week for maintenance, and he feels a lot better. And he doesn't have any pain when he scoots in and out of his mail truck. And he found a way to get his pain under control without surgery, without injections, without pills, and he's very happy.
Great.
So it's like, I use it for a lot of things.
That's really nice.
Knees are great. Any arthritic condition is great for it.
That's
and
really nice.
And end up using less pills, causing side effects. So I'm happy. The laser is amazing. The gel is amazing. And then it's just interesting how all my colleagues use them differently, and how, like, what I do is I just give the injection first, and then I do 10 or 12 MLS in a row with a boot for about 3 weeks. That's my protocol, but it's not, I could see where doing the shockwave and the MLS at the same time works a lot better. I didn't even think of that before. So it's really cool, very interesting.
Yeah. It's just, like you said, there's a million ways to skin a cat, right? So that's the same thing here, is that there's so many ways to achieve the same the results, if you will.
Yeah. All right. Well, thank you so much for coming on my podcast today. I love collaborating with other colleagues and seeing what they're doing. And we're doing great things together. We're just helping other people, all the patients with pain. And Dr. Wadehra, thank you so much for your time, and for all the people in Michigan. Hopefully they'll get around to hearing us together.
Thanks for having me on. I appreciate it.
Thank you so much. Have a great day. See you next time.
You too. See you next time. Bye.
Thank you for listening to the LMD Podiatry Podcast. For more information, visit lmdpodiatry.com. That's lmdpodiatry.com. Or call 954-680-7133.